Hi, I'm now going to discuss the last and most influential observational study design, the cohort study. Most cohort studies are prospective, which means that people are followed over time. In cohort studies, a lot of people are enrolled. We're talking tens of thousands of people, and are followed for many years. The key point is that the participants report their dietary habits at the beginning of the study, and sometimes again every couple of years. The participants are then followed into the future and asked to report when they develop a certain disease. Most cohorts are focused on a particular type of disease, such as cardiovascular disease or cancer. And because the collection of the information on people's diet happens before the collection of health and disease data, there is no concern as to which is cause and which is effect. For instance, a cohort study examines the relation between diet and heart disease. It stands to reason that people may change their dietary and lifestyle habits in a positive way after they get a heart attack. Fortunately, the prospective nature of cohort studies avoids any debate on this issue because dietary intake is assessed before the heart attack occurred. One of the major cohort studies on diet and health is the Nurses' Health Study, which is coordinated from Harvard University. The study was initiated in 1976 with over 120,000 U.S. female registered nurses between the age of 30 and 55 years. And these nurses completed a mailed questionnaire about their lifestyle factors, about health behaviors, and medical histories. The study was expanded in 1989 and has so far included over 238,000 nurses, a really big study. An even bigger study is the European Prospective Investigation into Cancer and Nutrition, called EPIC, with more than 500,000 participants recruited across 10 European countries and followed for almost 15 years. The EPIC study was originally designed to investigate the relation between diet and cancer, but it has also been used to study a relationship between diet and heart disease. As pointed out above, large cohort studies are very powerful studies, and because of that, they have formed the basis for many of our dietary recommendations. And although they have provided a ton of information on the relation between nutrition and health, it's important to realize that cohort studies also carry several limitations. First of all, cohort studies, as all observational studies, rely on self-reported dietary assessment to acquire information about people's diets. And as mentioned before, the major disadvantage of self-reported dietary assessment, such as a food frequency questionnaire, is that the information collected may not always be very accurate, as people either purposely or subconsciously embellish or misreport their dietary habits. In addition, it's difficult to capture the complexity of people's diet in a single questionnaire, especially when the dietary habits of the study participants are very diverse. Another limitation of cohort studies is confounding. Imagine there is a cohort study that finds that lung cancer is much less common in individuals that consume lots of vegetables, as compared with individuals that hardly eat any vegetables. This finding may lead to the conclusion that eating vegetables is associated with protection against lung cancer. However, people that eat lots of vegetables are probably much less likely to smoke, a very important risk factor for lung cancer, and are less likely to have an unhealthy lifestyle in general. Vegetable intake by itself may have no effect on lung cancer at all, and the observed link with lung cancer may be entirely explained by smoking. In this example, smoking can be classified as a confounder. Smoking is also a major confounder in many cohort studies investigating the relation between diet and heart disease, as smoking greatly increases the risk of developing heart disease. Fortunately, the effect of confounders can be partly or mostly removed in the analysis of the data, but the judgment is never perfect. So, in short, cohort studies are the most powerful observational studies, they have contributed substantially to our dietary guidelines, particularly the super big cohort studies. By being generally prospective, they do not suffer from reverse causality. However, they're still observational studies, which means they reveal associations and nothing more.